A health alert for you tonight. It's a common and dreaded injury, but is surgery always the best way to repair a torn ACL? Liz Kreutz with a surprising study.
It's happened to soccer legend Megan Rapinoe, NFL quarterback Daniel Jones, even aspiring mixed martial arts fighter Mark Zuckerberg. ACL tears are one of the most common and debilitating injuries for both professional and recreational athletes, between 100 and 200,000 a year in the U.S.
You can see it's completely torn.
For years, knee experts considered surgery the go-to option. But a recent study in the British Journal of Sports Medicine found that 90% of ruptured ACLs treated without surgery showed signs of healing 3 months later, indicating non-surgical treatment could be an effective alternative.
What we have seen is people begin to question whether this should always be done.
Dr. Bob Salas at Kaiser Permanente Fontana Medical Center in California has seen firsthand the benefits of non-operative treatment.
Surgery can always go wrong. It's not a perfect procedure. And in fact, we know that about 1 in 3 people who have their ACL reconstructed have another ACL subsequent injury, have another ACL tear.
That's just what happened to Dr. Salas's patient, Dr. Maryam Sadie, who had ACL surgery 15 years ago.
When you tore your ACL, what options were you given?
I was asked, do you feel the knee shift when you're going up and down the stairs? And I said yes. And so I was not given options. I was recommended surgery.
It took a year before Sadie was back to playing competitive basketball. She still walks with a slight limp. Then earlier this year, she tore that same ACL. This time she opted against surgery. 4 months later, with the help of a brace and physical therapy, she's back on the court.
Non-surgery, I have to say, it's been really nice.
Just gonna pull and push.
Dr. Salas says there are cases where surgery will be the best option, but that doctors shouldn't jump to the conclusion.
Is the larger medical system set up to incentivize surgeries?
As a surgeon, you make your money doing surgery, so most surgeons want to do surgery, and not just because they make money by doing it, but because they think it's the right thing to do.
The knee, he says, may be more resilient than previously believed. Liz Kreutz, NBC News, Fontana, California.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.